Hi guys, good afternoon. So I want to start with a disclaimer. We just heard from a panel with very deep expertise in healthcare. I'm a person who was, just until a year ago was selling shoes and smartphones. So I'm still learning about health. It's it was very interesting to hear different perspective and opinions in the previous panel. So what I'm doing in this brief talk, maybe talk a bit of my kind of personal journey on the health side, some of the things I've encountered, and also whole genesis of Curefit and our overall thinking and approach. I think what we eventually end up doing, I think it's very much work in progress and probably take few years to play itself out. Going back to Mintra, first 4 years we didn't really know what we were doing. We were doing something until 4 year into a journey we realized that we should be into the fashion retailing business. uh, so personally, I've been, for me, the closest connection to health has been through sports and fitness. I've always been very active in sports. But when I moved to US, I used to live in an apartment which has, and there's a McDonald's right next to it. I was around 21, 22, vegetarian, and US, in Chicago, not that easy to find, vegetarian breakfast. So McDonald's, the only vegetarian thing on the menu was hash browns, and you know, first time I tried it was obviously extremely tasty. So hash brown became my breakfast every day. Go down, have 4 or 5 hash browns and a cup of coffee, and off you go. And you can imagine, maybe in your early 20s, that kind of diet you can get away with it for a while. But in my mid 20s, and obviously I started gaining weight, etc., and somehow managed to get into fitness around that time, and stayed on with fitness for last 15, 16 years. Over the years, I've seen, both personally, the impact of fitness, as well as um, read a lot now about, and I truly deeply believe, if there is a miracle drug in the world, it is fitness. I think the earlier outside Hari was saying about, if take are active 45 minutes a day, pretty much most of the health issues will be sorted. I again, going back to my Myntra and Flipkart days, it's fitness was a very big part of what gave me stamina and the capacity to deal with bunch of things that will happen during the course of the day. I mean, massive roller coaster. But every time I managed to get a little bit of workout in the morning, you just felt that you can deal with almost anything in the day. In fact, there's been days where I will miss workout for 2 3 days in a row and start to really feel depressed and low on energy, and I'll go to office, and by midday I'll realize that I'm really not here, can't do this anymore. So I'll cancel next 2 3 meetings, go home, work out for an hour, and come back, and suddenly I'm a changed man, and will have stamina to go through very late into the day. So that's kind of on the personal front. It's been fitness something I've been very very close to for close to 2 decades now, and I've seen its impact on you know myself, as well a lot of people around me who have taken fitness, and the benefits, just I don't know where do you stop, right? From you sleep really well, never any sleep issue. Your appetite is really good. If you're into fitness, you automatically tends to eat better. Uh, just very difficult to get stressed or depressed. If you are doing any kind of physical activity, including walking or yoga, whatnot. All the lifestyle diseases have a huge impact. Again, if any kind of physical activity, your long-term risk of most lifestyle diseases go down. All of longevity studies, find very strong correlation, and on and on, right? It just doesn't stop. So last year when Ankita was starting, Curefit, so we kind of came at healthcare from outside in perspective. We thought, we'll just start from a blank slate. The initial, thesis was very large country, very underdeveloped, healthcare system. Obviously, some, great hospitals, etc. But if you look at the country level, big gap, in terms of number of doctors to people, one of the lowest doctor to, population ratios in the world. Even more dire if you look at, mental health. Uh, but like we've seen in last 2 decades, first with telecom and second with retail, the what Hari mentioned, laggards, have an opportunity to leapfrog. So we felt that maybe there's an opportunity to build a kind of future of healthcare in India. Maybe the odds of that are better than anywhere outside, and it seems to a very good time as well, because there's a lot of innovation happening in healthcare. In I spent my first decade of my career in Silicon Valley, and I've seen disruption of many industries. We've seen a bunch of disruption in India as well. But healthcare, fundamentally, it's same. There is obviously a lot of technology coming in to assist doctors, hospital management system, some decision support system, etc. But those are enabling technology in the way you find a doctor, how you visit, the interaction with the doctor, how the reports come to you, the prescription. You know, I have not seen it change in last 20, 30 years, not in India, not even in West, right? But there is a lot of interesting technology developments happening in everything from uh, simple, just concierge services to slight, automated diagnostics to digitization, lot of health data, to miniaturization of diagnostic devices, to, big insurance companies, very seriously pushing towards healthy lifestyle because that's, most in the Western world with the healthcare costs rising to as much as 17, 18% of GDP, one day that has to stop. And the only way that can stop is people start to, get sick less often, which means they need to have a healthier lifestyle. So all the insurance companies and big healthcare system are driving this massive push towards encouraging people to adopt healthy lifestyle. So these are all just bunch of trends globally. I guess my other big trend is just with mobile phone connectivity, a lot more and more stuff is becoming possible through mobile phones. So it seems the you know, world should see a big transformation in health over next 5 to 10 years. And again, all of this will not have happen overnight, but enough science seem to be there. And India is a perfect fertile ground because of the gap in healthcare systems. Other overall, pretty underdeveloped, healthcare system, not massively regulated either, but almost everyone is connected now through smartphones. So can one take advantage of uh, the new developments in technology, the state of affairs in healthcare, and kind of come up with a completely brand new approach to healthcare? So that was what convinced us to even take a shot at it. If I look at Curefit, big picture, 100,000 feet level, we really have two core ideas, and Hari kind of mentioned both of them. One is, can we build a platform where we marry preventive and curative healthcare in a intelligent way? It's today look at all the providers, they very quickly segment themselves. They are preventive guys. Someone may be selling health food, someone selling fitness, maybe meditation apps. There are hospitals selling health, your annual health checkups, etc. But when you fall sick, you can somehow seek out a doctor. Doctor hardly ever even talks to you. What's your lifestyle? What do you do every day? What do you eat? Whether you go for a walk or not. It's like, what is the symptom? And doctor in this, I'm not sure, 10 to 15 minutes. Most of my interaction been like few minutes. In that few minutes, doctor tries to figure out, what is the, you know, um, if your test is needed or what is the medical prescription, and off you go. You pop those pills and hope for the best, and and then next time fall sick, cycle starts almost from scratch. There's rarely even a discussion about history and so on. But I think every single doctor also knows that probably bunch of lifestyle choices are affecting your condition, and if you were to take care of that, chances of that happening will be lower. uh, so that's how can we conceptualize a healthcare system where those two uh, different aspects of health are more tightly integrated. Other is exactly what Hari was saying, which is why do you need to go to a physical space for every single thing? For something you have to go, but there are a bunch of things that are possible over phone or internet, maybe something at home. So, and for India, that's super critical because if you look at the ratios of doctors to population or number of beds to population or consultation, it's just not going to catch up. The gap is so massive unless everybody just starts going for medical degrees. The number of doctors is just not going to happen to service most of the population. So, some digitization. Is required, which will significantly improve the efficiency of doctors and hospitals, um, uh, and all the physical infrastructure. So that's kind of a second idea. How do we bring a lot of digital elements in how healthcare is serviced? So having said that, that's a vision level. It's will take many years, perhaps 10 years, for us to fully build out the entire vision. So we have segmented what we are trying to do in multiple phases for us, and trying to take on simpler problems first. So at the moment, we are mostly focused on enabling a healthy lifestyle for people. Again, in the healthy lifestyle, interesting journey. When last year we were looking at it, we uh, coming in, we have very different assumptions about healthy lifestyle. We thought it require a lot of education, evangelism, creating personalized plans for people, etc. Maybe doing something for discipline, motivation. But when you start down consumers in the field, we realize the at least in big cities, the biggest problem is fulfillment. It's just so very hard to get all the things you need to live a healthy lifestyle. Especially for food. The moment you step out of your home and you try to eat, 3, 4 healthy meals in a day, it's just extremely difficult. Not that it's impossible, but it'll require, Herculean willpower. You really need to like be vigilant all the time. If you the moment you are off guard, you'll be eating something that you can't eat for many days in a row. So we, for the moment, we're just focused on how do we make fulfillment for healthy lifestyle easy. Uh, and as we're building that solution, there are few, two, three key principles we're using, which we think it's pretty relevant for Indian context. One is where kind of our entire offering is built with very hyperlocal markets in mind. So we're trying to build very deep density in each hyperlocal market. Second is very strong online offline connect. So online is great vehicle for customer acquisition, engagement, but offline for fulfillment. And um, yeah, so these two being absolutely kind of core pillar of how we're building about these services. Actual platform, so we are trying to cover the whole spectrum of stuff you need to have a healthy lifestyle, which is your fitness, health food, meditation, sleep, your health checkups. And why are we doing all this in one platform? Most people treat them as a separate business. Again, it boils down, if you look at consumer lens, if I want to have a good health, I need to take care of most of those. It's not like I can say, I'll work out, but I'll eat anything, I want. Or so people who are really healthy, they generally, through um, self-education, some life experiences, something big happened in their life. They figure the whole system out after years and years of experimentation, research, putting it all together. And if you, think of somebody in your, friend circle or family who has a healthy lifestyle, probably, eats better, has some kind of workout regimen, probably sleep well, may even be meditating, and people in their 30s, 40s onwards might even be doing a health checkup. So it's a bunch of things you need to put together, but if I know anything from, again, e-commerce experience, for an average consumer to put all this together is just too complicated. It's just, no matter how much someone, preaches or highlights a risk or the benefits of following it's just too difficult for an average person to do research, figure all this out, find the solution, be disciplined about it. And that's really why we are trying to put all of it in one platform. But we're saying, if you're interested in healthy lifestyle, we will put it all together for you and we'll make it fulfillment really as easy as possible. So if you have the intention, we have the solution. You don't really think much about it, which means hiding a lot of things away from consumers. In the I'll take one example in health food. A lot of people try all kind of calorie counting. Basically it boils down, you keep track of everything you eat and upload a picture, and somehow someone's figured out the calories, and for your goal you need to have whatever 1800 calories, 2000 calories. It's just all but impossible for majority of people. If I contrast that with e-commerce experience, every 100 millisecond that the page takes extra to load, you see a drop off in conversion, and at large scale that's a huge sales loss. So those are the people you're dealing with, who can't wait 100 millisecond, which is 1/10 of a second. They abandon your website, and then expecting them to keep track of their food every single, not going to happen. So our approach is uh, forget all of that. If you can just shift to having one healthy meal every day, that will have a big long-term impact. So if this offering is launched, you can subscribe to, let's say, lunch pack, a small mini 5-day subscription. Once you subscribe to it every day, 12:30, 1 o'clock, that food comes. And if we crack the taste problem, if people enjoy that food, they can get habituated to eating that. So if you don't do anything else, just subscribe to that one meal, over a period of time you are eating healthy, more nourishing food. It's balanced, calories are not excessive. So most likely, whatever you've been eating, this you will over a period of time, you'll end up losing a weight. It's roughly about 7, 8,000 calorie deficit translated to 1 kilogram of weight loss. So if you have 200, or 150 calorie less in, 6 to 8 weeks, you will see 1 kg weight loss without even trying for that, right? And similarly, how can we do other things? There is on meditation, the few apps in West become immensely popular. Headspace is one, Calm is one. I guess meditation is probably second, miracle drug, next to exercise. Just there's the countless studies now which shows what a 10-minute meditation can do to your life, or even 1 minute meditation, or even just one very focused meditative breath, right? And some of those things can become a habit. It's a If you are doing just few minutes of meditation every day, chances are you are a little more aware through the course of the day, slightly less stressed, which means slightly less likely to give in to temptations, etc. So all those, again, the small changes, add up. There is tons of literature around habit building, small nudges, tiny habits. So we are trying to factor, all of those, so learnings from behavioral sciences to build our application in a way where it is continuously focused on small, small nudges. So this, kind of where we are now, and for the foreseeable future, we'll continue to just work on that. How do we make it easy for large number of people to follow healthy lifestyle? But if you are able to do that, then you can kind of see the rest of the story. It's a platform which is able to uh, encourage and keep people to follow healthy lifestyle, would reduce long-term lifestyle disease risk significantly, which is which has immense benefits both for the consumer and for the business. So for us, that journey will unfold over, I guess, next many years. But for now, we're just really focused on helping people build healthier habits and make the fulfillment across all dimensions of healthy lifestyle very easy, including health checkups. Very early stage for days for us. Just launched in Bangalore, been around for a year. Slowly, we'll be taking it to other cities. But the longer term ambition will be how do we translate that into a platform that most of India can use. So yeah, that's kind of very high level Curefit story. But love to keep this interactive and answer any questions that you guys may have.
Am I audible?
Yes.
What surprised you most in this journey in the last 1 year?
I think biggest surprise was myself. How why would you again start a company? After toiling away for 10 years, I had no idea how hard it is. I've already forgotten about all the early days of Mintra. Going back to a small house in HSL layout and building a team from scratch, learning about a domain that I have practically know nothing about, and making things happen. The 0 to 1 stage is yeah, it has lot of challenges that I had conveniently forgotten about. Um, uh, I think other it's see, in my past job, I was pretty disconnected from younger folks in the team, who were joining, fresh out of college, 1, 2, 3 years of experience. All my context was from late 2000s, and now I'm again working. Most today's Curefit team, I think average age is 26 or 27. I'm 42, so it's like probably two-generation gap. But how aware the youngsters are, both, about what's going on in the entire ecosystem. Ambitious, it's a I can't even imagine myself having that much exposure and context. So I am like immensely loving that part of my job now. It's like very very fresh, energetic, vibrant environment around me, and I think it's a really good sign of, I guess, things to come for India. It's the the current generation, meaning people in their 20s, really, I think they are in their whole life they've seen this emerging India, advent of internet, social communication, etc. So they are very very aspirational. They don't know the what's not possible, and with such a huge number of people coming to workforce with that mindset, I think just bodes really well for India future. So very excited about that.
Uh, Congratulations, Mr. Bansal. I'm a physician, and I really think what you're doing is really good for the patient. And I'm in preventative medicine, and I really think that curing your mind, your physical health, and your eating lifestyle is the key for the general public of India that India requires. But I need to know one thing from you. What are you bringing with healthcare from the prevention aspect? Are you instituting that you're going to also have health checkups along with that, incorporated with your providing physical fitness, meals, and psychological health for patients? How are you going to ingrain the health checkups in it?
Yeah, so I think for the kind of V1 of our product, everything you need to live healthy lifestyle, which is fitness of any kind. So we have a chain of fitness centers called Cult. We've got about 11, 12 centers in Bangalore. But for us, fitness again not limited to gym. If you do 10,000 steps every day, that's great. If you do yoga at home, that's great as well. So any kind of fitness. Second is health food, eating at least few healthy meals every day. That's a big part of platform. Third is meditation, which is more on the preventive side, but some meditation every day. It's has a huge long-term impact on the mental health. Sleep, so sleep tracking through app as well as all the tools. Uh, Maybe meditation, etc. You need to sleep better because again, sleep is one of those foundational health habit, has a big impact. And yes, health checkup. So your depending upon your age, etc. Your 6-month annual health checkup and integrating all of that together in the platform. Today these services are like bit in isolation, but over a longer period of time we'll start to integrate them so that these are also connected with the health goals or a health condition that you may have. Go ahead.
I'm Charlie. I'm a doctor, but now into health technology. The first question is, so you've done great work, of course, but did you find it challenging to enter the healthcare space? Fitness to, I would say, a lesser extent, but healthcare, I believe, is more of a niche and very specific industry. So what was your experience there, first? Second question, I think a lot of tech startups today, including health tech startups, are seeing a lot of value in the data which they collect from patients. So, do you have any such plans for Curefit as well?
Well, so I mean, we're still in the process of building the product, and so we'll see the challenges we encounter. So far, I think I feel the biggest challenge to build phenomenal product. I think the thing with country like India is very big market. There are a lot of consumers for almost anything as long as you build a really good differentiated product. So most our focus, to be honest, is more inwards. Like, is the product really stellar? Can I myself use this product? Can my friends and family, can they use this product? And just whatever is available outside on the healthy lifestyle is just not that good. So I don't think we are seeing any external challenge in terms of consumer adoption or very stiff competition, etc. And coming from my background, I think competition is probably going to scare us less now. I think dealt with the global best, but no, I think that challenges are really like completely internal right now. It's plus every day we're learning about this space. It's a Health is also very vast space. People approach it from very different angles. What we are doing is no one is doing. So if at all challenge is, can we really build this kind of system? As we studied this, we looked around the globe. It's both scary as well as exciting that almost nobody around the world is doing what we are doing, like bringing all these services on platform, except maybe some of the large health insurance companies who are encouraging people to have healthier lifestyle. So probably that at times a bit scary, if we can pull this all off together on one platform, but also it was what's giving us a lot of energy too.
Hi Mukesh. My question is like when you look at the customer acquisition, what are the factors that you look at or you take into consideration for your product?
I think it's probably two, three very obvious factors. One is you need to understand who you're building a solution for, and are you acquiring those guys or somebody else? Because through these digital marketing, a lot of branding, etc., you can acquire customer easily, but it may be the wrong person who tries the product once or twice and goes away. Longer term, from acquisition, from business model sustainable point of view, customer acquisition cost really matter. For an early stage company, the acquisition cost can be pretty high in some ways you need, economies of scale and the brand presence to drive it down. So like finding the right balance in the early days. For us, what's working is, I guess one advantage of platform multiple services is we can acquire customer for one service and then upsell bunch of other services. So today we are able to acquire majority of customers for fitness, and fitness tends to be very high ticket size. So that way, the acquisition cost is, very small fraction of the initial ticket size. So it's kind of more than pays for itself, and then we have a bunch of other services to upsell.